cases. It is March the 11th. What is that? 3 weeks, 4 weeks? 3. 3 weeks. And that's like 2 weeks before spring break. Spring break. So, you know what? We're getting closer. And we're all surviving. Aren't we? Carly, you here? Yeah, Carly. You're not Carly.
Oh, she's taking a phone call, I think, outside.
Oh, yeah, asked her. She's in that.
She's here. She's just not.
She's here, but she's not here. Okay. All right. Hold on a minute. Carly. You got here just in time. Okay. Okay, we all here? We are all here. Okay, so one thing I wanted to share with you before Ms. Rapp gets started. Do you want a mic, Ms. Rapp?
Sure, I mean, I have a pretty loud voice, but I think I might make it even louder.
Well, and I would like to give you one,
I can always.
but someone took it.
Is that one of the prizes?
No. Okay, so let me tell you about an article that I came across. Do y'all know that I like current events? Yes, I like current events. I like to read articles. And I got this article in my email like 2 hours ago. So it's hot off the presses. And tell me if you agree with this. Without oversight, electronic prescribing can harm patients. In what way? You're right, but in what way? Ooh, overprescribing what? That is exactly what this article is about. Overprescribing opioids electronically. So, you know, that's a big issue in our country today, not only our country, but our state. Do you know who's the #1 prescriber of opioids in the country? Alabama. We are the #1, but we also do have a prescribing database where all of our prescribers of opioids or scheduled medications go into a database every time they prescribe one. So if they are overprescribing, the system is going to alert on that prescriber. And it could launch an investigation. Have y'all been watching the news in Huntsville over the last couple of years? You know how many physicians have lost their licenses right here in Huntsville? A lot. One just,
That was,
oh,
yeah, sorry.
I thought Dr. Lons was back with her game. So we had one in the city of Huntsville that just lost their lawsuit a couple weeks ago for overprescribing narcotics, and definitely can cause harm. So does Health IT prevent all safety issues?
Ways around everything. People just want,
What's that called?
I don't know, people that want it, they're just gonna get it. It's called, using, it's a federal offense, using some misuse, abuse.
Yeah,
Uh,
that's one thing,
What about some
but
more
you
words?
said there's a way around everything. That's a workaround. Oh, this doesn't work like this? It's impeding my progress? I'm gonna take this route. And when I do that, I'm going outside the safest practices, right? and that's gonna present a problem. Okay, but I just wanted to share, if you wanna see this article, I've got it, you're more than welcome to read it in your spare time, like you have any of that. But Ms. Rapp is going to go over chapter 16 briefly with you, because the majority of our class today
Game time.
is competition.
I do love good competition.
So if you have not prepared for class today, you may not be reaching into my bag. You may reach in here if you are a lucky chosen one that answers all the questions. Oh, it's a personal challenge. Oh, yeah. The lacrosse team is on it. They don't even know what's in here. They're like,
Doesn't matter what the prize is.
No,
It
you're
doesn't.
not winning.
See, I'm the same way, it's just the
So,
winning.
if you have prepared for class, your chances of being able to reach into this bag of prizes of insignificant value are much higher than if you didn't.
But if you listen really closely, I
You
will
might be able to be
give you-
bailed out.
Yes, you gotta listen to me.
She might bail you out.
Yep. Write it down. That's testable.
All right, rock on, Ms. Rapp.
Which way am I going here? Oh, way there. Okay, objectives. Let me get this straight. So, today we are gonna talk about standardized terminology and the benefits that it gives to documentation. Okay, we're also gonna talk about how documentation using that terminology, the standardized terminology, can inform evidence-based care. And then we're gonna talk about the opportunities that electronic documentation brings to nursing. Nope, wrong way. Gotta keep you on your toes. All right, so let's talk about the history of documentation. So, documentation has been done for around 100 years, right? It's not always been seen as important. Would you guys say that documentation is a big part of nursing today? Yes. Right? It's huge. It wasn't always that way. Historically, healthcare was done by a family doctor who took care of your dad and mom, who took care of their dad and mom. And so they knew Uncle Ned had died at 38 from a heart attack, right? They didn't need to have documentation to show that. They knew your family history because they knew your family, right? But nowadays, healthcare is done by strangers, right? And it's sometimes a large team of strangers that are taking care of you. So nowadays, documentation is everything. A lot of times, back when documentation was just beginning, the only documentation that was really happening was they measured negative things, negative events that happened. What we do as nurses is not always clear through our documentation. So the absence of that documentation can only hinder us as nurses.
Excuse me, can I give you an example?
Yeah, go for it.
Do y'all remember in lab this week? And we said, please do not use WDL. Why? I need to know that you know what normal is. Because it's not clear to me, if you just tell me WDL, it's not clear to me that you know what that means. So that's exactly what she's saying.
Yeah.
It's not always clear in our documentation.
Mm-hmm. Yeah, and so that's what we're going to talk about today, and using standardized terminology, which is, we need to be consistent throughout with our verbiage, right? With our vocabulary, because if not, then we can't see big pictures. We can't see patient outcomes. So we have to be clear with our documentation. So let's talk about some pioneers in nursing, right? So everybody knows who Florence Nightingale is, right? If you shake your head no, I'm gonna ask you to leave. I'm just
She's
kidding.
200 this year.
She's 200 this year, important fact. So Florence Nightingale was really important because she had the initial emphasis on research and data collection. She kept careful statistics on diseases and mortality rates during the Crimean War. And then she also used that data, so she not only collected the data, but she utilized the data to make recommendations about environmental, hygiene, and hospital design. So she was kind of our pioneer, right, when it came to data collection. Bertha Harmer, she was around in the 1920s. Her big thing was that she proposed that nurses should prescribe care such as doctors do. So doctors provide medical care. Her thing was nurses should prescribe nursing care, which, you know, today we do that. She also noted the importance of aggregating data to organize knowledge. So hers was all about kind of the nursing function part of it. Then along came Edna Huffman in the 1970s. So she asserted that the purpose of nursing notes was to communicate during a patient's stay. She said basically like, the doctor needs to know what's going on, and then when I hand off report, this other nurse needs to know what's going on. But hers was really just focused on nursing while they were staying in the hospital. They were not included in patient medical records, and they were actually destroyed after a period of time. So those three are really important. Right? So outcomes potentially sensitive to nursing. So there was a study done by the Department of Health and Human Services, 5 million patients, almost 800 hospitals, and it was over 11 states. This study showed that the more registered nurses that they had, the fewer the adverse outcomes. So they did a study showing that outcomes and their relationship to nurses and the nurse-patient ratio was improved. So it's saying that, with the OPSN as a diagnosis, it's thought to measure the contributions of nursing care, right, on patients. So those are a few examples of those diagnoses. Right, so nursing affects those diagnoses, or can affect those diagnoses, right? Tell me if I'm going too fast.
They're taking better notes for you than they do for me.
Because there's a game, it's
I'm gonna-
competition.
I know.
There's things on the line, Dr. Guerra. I told you, it doesn't matter the prize, it's all about the winning. I should have brought a trophy.
Y'all have really
People
high
will fight
hopes.
over a trophy. It doesn't
Okay.
matter whether, it could be like a soccer trophy. And they'd be like,
Point
"I love
taken.
it." So, the impact on evidence-based care. So, without documentation, things are going to continue the way they've always been done. Have you guys heard that? We're just gonna do it the way it's always been done. So what is the point of evidence-based care? Exactly, right? So we're gonna show you what the evidence is and how it can improve patient outcomes. So there was a study done in 1927 where nurses were, and this was standard practice, the way it had always been done, nurses were using the same thermometer on multiple patients. And what they would do is they'd soak them in a solution that was thought to disinfect them. But one hospital was like, this seems kind of sketchy, so let's do a study on this and see if that's really disinfecting the thermometers. And they found that in the process, there was still streptococcus and pneumococcus on the thermometers, right? You want that going in your mouth? So, interestingly enough, that was in 1927, that practice of soaking these thermometers after multiple patients continued until the 1960s. Because it's the way it's always been done, right? So documentation today is so important because we can show the connection and we can show how that evidence-based care improves patient outcomes. So research, right, what I just said, can improve those outcomes faster than the casual experience, right? The in the hospital clinical experience. So if we have the data that says that thermometers have streptococcus and pneumococcus on it, can we change that if we have that data? Can we change it across the board now? Yes, we can. So the nursing interventions classification, we're gonna talk about that in a minute, but basically it's showing that different terminologies were being used for the same interventions, and so things weren't necessarily getting tracked correctly. They weren't, the data was not aggregating to show anything of significance. So let's get into the meat here. So standard language that reflects nursing diagnoses, interventions, outcomes, and other elements related to the care experience. So don't get so much wrapped around the word, right? So if you think of standardized terminology, you think of words, right? So it's not just words, it's systems that have words. So these are a way, the standardized nursing terminologies, they're systems, they're a way for nursing documentation to be leveraged to generate evidence related to nursing practice. Does that make sense? It is a way for us to collect data to show how it can impact nursing. This allows us to focus on outcomes rather than tasks, right? So if I'm in the hospital and I'm taking care of a patient, I come in the hospital, oh man, I gotta get those 8 o'clock meds, I gotta change so-and-so's linen, I gotta go over here and do a bed bath, I got, you know, all these little tasks that I'm focused on, instead of being focused on that patient's nursing diagnosis. What are my interventions and what are the outcomes that I expect for that patient? So it kind of gives you a big picture and helps you plan for those outcomes. So standardized terminology really started kind of, you know, emerging significantly in the early 1990s. They wanted a way to quantify nursing for management, and they wanted to develop electronic patient records, and then they wanted to ensure that nursing had visibility within healthcare systems. It started as controlled vocabulary, but this was really restrictive because what they would do is just give you a drop-down list. There was no granularity, which we'll talk about in a minute. So you want to be detailed when you're documenting. If you were using this drop-down list, do you think that you could be detailed in your documenting? No, you can't, right? Because, you know, there's so many other things that you might want to include, but if you just have a drop-down list, you can't necessarily include it. So it's kind of like that what was the open source thing that you guys did, was it last week?
Yeah, the Marymount
Yeah, you know,
document.
There was a lot of things that were kind of like, this isn't really work, it's not really functional. So it's ever evolving. So here's the categories for standardized terminology. The ANA, the American Nurses Association, recognizes 10 terminologies that are useful in various nursing settings. 7 of those are nursing specific, and then 3 are multidisciplinary. And we're gonna go through each of these. Now, you don't necessarily have to know each term, like each interface, each reference. You don't necessarily have to know, but think big picture, right? So I'm gonna talk about how kind of they started, how they've evolved, how it helps, and then we'll go into kind of how it helps us as nurses today. So you don't necessarily need to know specifics. We'll talk about it in a second. So minimum data sets, nursing minimum data sets. So these are a list of categories of data with a definition of what's included. This represents the first attempt to standardize and collect nursing data. There's 3 types of minimum data sets: the nursing, there's a nursing management, and the international. You can kind of guess by their names what they do. So the management, this was designed for nurse managers and administrators and executives to capture data that is useful to them. So this allows them to pull together information such as scheduling, billing. And it also gives information about nursing at a local level, a regional level, a national level, and an international level. I hate changing it when I hear like a lot of.
I hope y'all are not gonna be disappointed.
It's never about the prices, it's about the glory.
Yes,
Yes. But it's about the game.
but only after the game, because if I give it to you before the game,
Then you'll know all the answers.
and then you have an unfair advantage over these prizes of insignificant value.
Yes. Yes. So the things that I'm saying that aren't on the slide are notes, but what's on the slide, I don't really read. That's kind of like just an outline of what I'm saying. So international nursing. So this is gonna have a little bit more detail. It's gonna have gender, training, education. It was conceptualized as a way to support nursing research. So let's talk about interface terminology. So this translates the clinician's common phrases into data that the computer can use. There's 7 of them. So the comprehensive nursing terminology, it's a comprehensive nursing terminology system that includes diagnosis, intervention, and outcomes that can be used across all settings. So again, I'm gonna go through them, but I don't want you to focus on so much, oh, the Nanda I does, like, we don't need to know all that. Just kind of get big picture, right? So the North American Nursing Diagnosis Association International, the Nanda I, this one is the most used in the US. Its intention is to communicate professional judgments that nurses make every day. So it's about nursing interventions and how they affect patient care. The Nursing Interventions Classification, the NIC, this identifies activities nurses do in their daily work. It can include physiological and psychological interventions. It can be used with individuals, families, communities. It's comprehensive, research-based, and it's intended to be used in the planning process and creating a nursing care plan, which is kind of what we talked about at the beginning, right? The whole point of it is to help big picture, to look at the outcome of your patients versus being task-oriented. So the Nursing Outcomes Classification, the NOC, is intended to provide a measurable way to evaluate nursing interventions on patient progress. It'll make a little bit more sense when I go over this next point. So if you use all 3 of those terminologies, all 3 of those terminology systems, they address the full planning and documentation for nursing care. So they address the problem, your diagnosis, the intervention, and the outcome. So there is one called the NNN, and that is all three of those systems kind of wrapped up into one. The clinical care classification, this was originally a home health system, and it was designed to for electronic coding to predict home health care for Medicare patients. But it's now evolved into a full clinical care terminology, and they've started to integrate it into some EHR systems. The Omaha system, this links clinical data to demographic, financial, administrative, and staffing. It was originally devised a way for home health care nurses to document their care. And then the last one is exclusive to perioperative nursing. It's the perioperative nursing data set. And it was intended to make visible to administrators the patient problems that perioperative nurses manage. That included from the entire patient experience, from pre-admission to discharge. So what do all these have in common? What's the big picture here? Somebody tell me the big picture of what these systems are doing. Right? They're improving outcomes. They're taking the patient and saying, here is their problem, here is their diagnosis, here is our intervention, and here's the outcome we expect. And then we're documenting using standard vocabulary to where we can aggregate that data and then use it to impact evidence-based care. Does that make sense to everyone, what this system is? So we're taking that data, and then people out there do their research, and they come forth with, this is the best evidence-based care, this is how we can improve patient outcomes with the best quality, at the best cost, with the best outcome for the patient. It's good stuff. Reference terminology. So these are specific to multidisciplinary. So these are not nursing specific. There is a coding for nursing problems subset into it, but it's not nursing specific. It is across the healthcare board, but it's an important standard in EHR. The SNOMED CT is an important, that's the most comprehensive.
That's the one you need to know.
Mm-hmm.
Not in detail, but you need to know about it.
Mm-hmm.
SNOMED CT.
So this captures, it has the ability to capture data from all healthcare professionals. Again, it does have a subset where nursing can code their problems, their nursing diagnoses. So electronic clinical records. So these allow documentation to be standardized. It has the ability to determine the effects on many patients. So again, looking at the bigger picture, if we're using standardized terminology, then we can aggregate that data and see the effect on more than just our patient. You can categorize it under nursing diagnoses, age groups, or any other criteria that they use. And it shows the effectiveness of intervention by demonstrating how those nursing outcomes were measured. But you must be using standardized terminology, right, to aggregate that data. So examples of standardized terminology are staging pressure ulcers, Glasgow coma scales, Apgar measurement and newborns. Those people who are competitive get what I'm doing. we make it standard? Granularity, I said that word earlier, right? So granularity describes the detail that is captured by a term or phrase. The greater the granularity, the greater the detail or the specificity of the term. So, example, would a clinical area need more granularity versus billing? Right? So billing just really kind of needs to know, like, what's their diagnosis, how long have they been there? They need to know specifics, but they're not going to get into details, right? Clinical area, you have to have granularity, you have to have specifics. Mapping. Mapping refers to a concept in one standardized terminology with a concept in another standardized terminology. So it could compare the NANDA nursing diagnosis of ineffective airway clearance to the CCC diagnosis of airway clearance impairment. Are those the same diagnosis? Anyone? Yes, they are. But because it's worded differently, right, there's not a standardized nursing. So that's why mapping is so important. It links. It can link those together under one. So, classification is the grouping of related ideas into a group, into a taxonomy based on perspective. Nomenclature is the lowest level of classification. So example of nomenclature is words that are in a dictionary that are organized alphabetically. Ontology is the highest form of classification. This provides the ability for terms to be represented and linked to multiple concepts. So what are some issues with standardized nursing terminologies? There's no standard on nursing content, right? Patient data can't be shared across care settings because there's no standard. So the demand for customization, we had talked about the Merriweather, what is it? Marymount?
Yeah, the Merriweather.
Merriweather. So we had talked about that and how you can customize it, right? And change it. So do you think that that has an impact across healthcare settings? If one hospital is adapting it to fit their need, do you think it's necessarily going to be able to relay to another hospital? So that because there's customization that's happening, that's not a standard. That could be an issue, right, across the board. And it's expensive because they have licensing fees associated with them. And it's resource intensive so you have to full-time people who do this. But let's talk about the benefits. So it increases quality of care, decreases the cost of care, contributes to evidence-based practices, and there's communication. All the things we talked about throughout this lecture are right there, and those kind of outweigh the issues. And this is what we're striving for in nursing, right? Are you guys ready? Hope you brought your stampers. I'm just kidding.
Okay,
Bingo
in
is
order
a
to play
serious
bingo,
thing.
you have to put $1 in the pot.
Right? $5.
$5 a sheet.
Yes. Look, I am on Redstone Arsenal and we have a bingo hall there. Let me tell you. People get crazy.
Okay,
Here.
do you have extras?
No, it doesn't matter.
No, it doesn't matter.
Just take the top.
Everybody got bingo sheet? I know y'all got enough notes. It's not a clear bag. Okay. Are y'all ready? You're gonna miss the first question. Go miss the first question.
So excited. All right. Let me get my collar sheet
Yeah, no
out.
free spaces. Free
Okay, so
spaces
listen.
are not for nurses.
Rules of bingo. So we're gonna play by Julie's rules, Miss Rat's rules. I gotta get used to them. So it has to be a row or a line, not four corners. Okay, I know. I heard a sigh. We're gonna make this real hard.
There are some hardcore bingo players up in here. I didn't even know that was a rule.
Look, they brought out their stamper like, I'm ready.
I see highlighters.
I'm telling you, there are people.
Like, y'all don't need to compete with lacrosse, because look, they are serious over there.
They're covered in bruises and ready to go.
They're not scared of you. Keep clicking the highlighter.
Just no fist fights, okay? It's really not that serious. You can do a diagonal, yeah, sure. But it's gotta be, a line or a row or a diagonal, but no four corners.
Okay, here
All
we
right, are
go.
we ready? Let's go.
Oh, you know what I will do?
Oh, well, hold on.
You know what I will do? If you write your name on your bingo sheet and turn it in, I will give you in-class activity points.
Yeah, buddy.
That's not bonus points, but that'll go into your in-class activities.
Thank you.
I will do that.
You should have let me offer it. I would be all saying thank you.
They took notes for you.
I do feel honored that notes were being taken.
Like in a serious way. Okay, first question.
All right, are y'all listening? Who asserted that the purpose of nursing notes were to communicate during a patient's hospitalization?
Share your answers, because you know who's gonna win your prize, okay?
Oh, yes, see. All right, number 2. Who emphasized on research and data collection? She used analysis of data to make recommendations about environmental hygiene and hospital design. Again, if you get this wrong, please leave. She is. Some good stuff in there. Number 3, who proposed that the concept of prescribing nursing care just as doctors would prescribe medical care? She noted that the importance of aggregating data embedded in nursing documentation was important to organize knowledge. No, I'm doing my callers card, so when you get bingo, I can say, well, we're gonna go through it. So no cheaters, no cheaters. Also, these are repeat cards, so 3 people might call bingo at the same time, so just be aware. Yep,
Gotta be fast.
gotta be fast. Again, no fist fighting. Next question. This was used by the government to study outcomes and their relationships to nurse-patient ratio. Oh, I heard that.
Y'all giving your bingo away.
I know, like a little, yeah, are you gonna do it? Next question. What could improve patient care outcomes faster than the slow accumulation of casual experience? My bingo collar card is in order, so I don't know why. Do you have it? You gotta yell it loud and proud.
And
I need a stand-up, come on, like, bingo! No, this is either you know so, I need like a, I got a bingo.
I have a bingo.
All right, come on.
All right,
Do you
Will.
think you have it? Do I get a like loud and proud? Be confident in your bingo. Come on.
I'm really not.
There's 3 of you.
Oh, you
There's
gotta
3
stand
of you.
No, up you go. On
Let's
your
do
feet.
it. Come on. All 3 of you. What do you think the answers are?
Nightingale Research, the OPSN, and the Hammond.
Okay.
Yeah, that's what I got to.
All right. What, read off your bingo.
Bingo.
Nightingale, Huffman, OPSN, and standardized terminology.
No.
I got
But you 2 got it.
Okay, close your eyes.
Yep.
Close your eyes.
Yes, press ball.
Close your eyes. Oh, water bottle.
Right.
Okay, keep going.
Are we gonna keep going? All right. There's more prizes.
We got like 15 minutes.
Let's do it.
Let's go.
First to black it out.
Let's go.
All right. Next question. So this is standard language that reflects nursing diagnoses, interventions, outcomes, and other elements related to care.
Bingo, I got it now.
Stand up, yell it loud and proud.
Bingo.
I need like a little shake.
Look, ever gone to the senior center?
All right.
All right, hold on, wait.
So listen up, y'all. Listen up. Okay. What do you got?
Huffman, Standardized Terminology, OPSN, and Research.
All right. That's a bingo. Did you have that one too? Okay.
What you got, Will?
Standardized terminology, OPSN, Huffman, and Nightingale.
Good job.
What you got?
Yeah.
Oh, well, I had Nightingale, OPSN, Standard Terminology, and Research.
Yep. That's it.
Okay, I'll come to you.
What is that?
Oh, wireless speaker.
That's not a prize of insignificance. Look, she's like, I got bingo back here.
Yeah, no, bingo count if I was just like kind of
Oh.
didn't realize I had it till now.
Well, no, because you gotta do it like when I'm telling you, not based on what other people have.
Oh, I was like, I can't see.
Oh, you can shoot.
You get a pamphlet.
Ooh, Band-Aid.
Band-Aids. A pocket Band-Aid.
I eat it like all the time.
See? That's good. See, I have a paper pen that I just got right before this class. Yeah, I have a pen too.
Bring that to the next exam.
You need education. What was the pamphlet over? Was it at least something?
I don't know, there's a butterfly.
Was it? A pizza cutter? Hey, as a college student, that is really important.
All right, let's go.
Keep going? Are we keep going?
Do y'all want to study for the exam?
Yeah.
Keep
No,
going.
she said keep going.
Look, we got 10 minutes.
A list of categories of data with a definition of what is included. This represents the first attempt to standardize the collection of essential nursing data. What have we talked about? There's no I think. There is a I got bingo!
All right, Chris, let's go.
OPSN, Nightingale, minimum, or nursing minimum data set, and standardized terminology.
Okay, all right, Mariana, what you got?
Standardized terminology, Huffman, granularity.
And what?
Granularity.
No. say? Reusable grocery bag? Watch out, Ollie, here I come. She got it too. No, Mariana didn't get it.
Oh, express brain.
How many more prizes we got? Are we cleared yet?
We take all the pamphlets out though.
Yeah, I don't want to.
What are we even over?
They don't want it.
All right, listen up. This translates the clinician's common phrases into.
Ooh, Lord.
Lacrosse players are getting serious.
Oh, they are sassy. What you got?
Interface technology, OPSN, research farmer.
Bingo again.
No, you can only get one bingo.
Bingo in. Oh my God.
One bingo.
Okay, what's yours? Do you say reference terminology?
Hand sanitizer.
Y'all quiet down so I can hear. Oh, did you have 2 bingos? Did you got any bingos? Okay, well, that's all I need to know. I don't need to know your whole card.
Okay.
About farmers, standardized terminology, Nightingale, and interface terminology.
Yes, ma'am.
Interface, terminology, OPSN, farmer, and nursing
This is good stuff.
Sarah.
Farmer, research, OPSN, and interface terminology.
Now, y'all are standing up because other people are saying it. Oh, okay.
We got another hand sanitizer over here.
Hey, I have like a lot of hand sanitizer. It's delicious. Are you eating it? Do we need to call the show Intervention? There was an episode where a lady was drinking mouthwash. Yeah, to get drunk. Yes, and she had the cat, and the cat was like, what the? That was like one of my favorite episodes. What? Yeah, she was humping on the keyboard cleaner. The Intervention. I love that show.
When I was working at Walmart, I've seen people steal.
Yeah, well, they had to like put it behind cases and stuff because people were humping them again.
That's why they check IDs.
Yeah. Oh, well, that's a whole nother story. The Tide Pod thing's a whole nother. That's beyond addiction. That's like. All right. Any more bingos? Can I say it? Possible. All right.
How many more questions we have?
I mean, there's a few. There's one. Yeah. Okay. I did that one. So, this refers to terminology where each term has a definition that a computer can process and support the meaning when retrieved and aggregated.
Bingo.
Now it's getting serious. Are we past the point? Oh, hell. All right. Go ahead.
Research, reference terminology, OPSN, and standardized terminology.
Okay. Oh my God. The whole class just stand up. Okay, so you're good. These two are good in the front. All right.
I got research, Nightingale, reference terminology, and standardized terminology.
Okay. You're good.
I got interface terminology, reference terminology, research, and nursing minimum data set.
Okay.
Nightingale, reference terminology,
Yeah. In the sweater.
Nightingale, reference terminology, and research.
Okay. Yeah.
Reference terminology,
Crazy head.
Okay. Y'all gonna have to speak up.
Okay, interface
All right. Yeah. Okay. Okay. Is there more? Okay. Any more? Dr. Garrett, if we start running out of prizes, I can interest them in a half pencil, a paper clip, a half drink Propel. A what? Machine. Yep. No, you can't have the machine. I thought you said Cheetos. I said there's Cheetos there. I can interest you in an iPhone, Doctor. Right. You can have this microphone. This beautiful clicker. I just need some batteries. I'm making Dr. Garrett work today. Post-its are like a necessity. Those are important. You getting low? Well, so my fear is the next one I call, it's going to be like the whole class.
Oh, a trooper, a pen and a highlighter.
Watch out. Better keep an eye on that. Yeah, nursing 101. Label your pens. Nurses are notorious for stealing them.
It's a Bic.
It's a Bic.
So I can have the whole thing.
Gummy bears.
I want that prize. I do love gummy bears.
Okay, we can go one more round, but y'all don't get too excited.
Look, she's like one more.
Stay right there, dear. Don't leave.
All right.
Here's my plane check from my flight.
They can have that.
Okay, one more round.
Okay.
Oh, here's a business card.
So, what is an example of standardized terminology?
Bingo.
Oh, I like that guy. He said it with pride. Okay. Okay. Now listen. Listen. I'm gonna, when these people start calling it out, if you haven't stood up by now, you ain't standing up. Because I'm on to y'all's tricks. You're listening to everybody else. And they say, oh, I got that one too. So now listen. You ain't standing up by now, you ain't getting it. I'm watching.
Nightingale, reference terminology, Huffman and Harmer.
Yep.
AFCAR, standardized terminology, nursing minimum data set, Nightingale.
Yep.
Interface terminology, outdoor.
Okay. Okay. You already got one. There's no chooses.
No double dipping.
No double dipping. You got a good card though. You probably should go to the bingo hall. Okay. No. Sorry.
Huffman, interface terminology, APGAR, and nursing minimum data set.
Yes. Two more, Dr. Gary. But that was a twofer.
It's a highlighter. Now, there are a couple of, about 3 really good things.
Yeah, that is horrible. You know what the next one is?
It's a nail file. Okay. You have completed these. Would you like to see the 3 main prizes that you missed out on? Like, this is my opinion. This is a twofer. It has a pen and tiny Post-it notes that roll.
Do I get a prize?
Hand sanitizer. A USB port that goes in your car.
It's Katie's birthday, did she get something? She didn't get a bingo, her tour, so.
A twofer, a
Keychain.
keychain,
And a
and
flashlight.
a light. And it's LED. All right.
You gotta go to more conferences now.
Well, my next conference is the NSNA conference in April.
She's gonna replenish her bag of instant prizes.
So,
Oh, Disney.
in Orlando.
Do they
Anybody got
count?
the sports calendar pulled up? Yes? Yes. Okay, so let's make a deal. Y'all remember that game show, Let's Make a Deal? Okay, I will be gone